My name is Gordon Lewis. I've been an orthopedic surgeon now for almost 45 years. My main area of expertise was total joint replacement. Total joints work well in the right setting, but the problem is these two processes start. One is wearing and the other is loosening. Before most total joint surgeons would say, I don't want to do a total joint until you're at least 60 and better if you're 70. Well, now we're seeing patients that are in their 30s and 40s. And what do you do with them? If you do a total joint and they start having issues 10, 20, 15 years down the road, they're going to have a couple knee revisions by the time they're in 70s and 80s. So I was very interested in trying to find an alternative to total joint replacement. In surgery, like I say, most of the time it goes fine, but if something happens that's beyond your control, it can be life-changing. And so there's high liability. You try to avoid that, of course, and there's ways of minimizing it, but you never completely eliminate it. Now, as far as injection therapy, in my experience and career, I've probably given thousands of injections, and I cannot remember one that has ever resulted in an infection. So the liability difference between a surgical approach versus injections is like night and day. As far as non-operative treatment, cortisones and viscosupplementation more recently was about the only thing you could offer a patient. Stem cells, the theory is good. They're expensive. The problem is most patients that are faced with that possibility, they don't usually have the money or want to put out the money. The patients, first thing they come, with the first question they have is, how's this reimbursed? How do you pay for it? That's been the big disadvantage with stem cells, is the cost. And so when you tell them that it's covered by Medicare, that gets their interest up. And so when I found out that this was something that Medicare was looking at and was paying for, then that was a big plus. And that's where I really was stimulated because of that. I was impressed with the fact that they get pain relief. That's, of course, the main objective is pain relief. And the two biggest areas that most people have pain in is, as far as joints are concerned, is knee joints and shoulders. And I found that the product makes a big difference in both of those areas. I have many patients that the shoulders felt better. A lot of times you can avoid surgical treatment, especially in the smaller or partial tears. Even the partial rotator cuff tears come in different, gradations. And that's where you really see a lot of improvement and long term. I think if you sat down and calculated out the time that a person or a surgeon would spend in the operating room and the income involved versus time giving injections, you would be amazed that there would be a comparable or maybe even better financial rewards. I even went down to Scottsdale, sat down with the personnel there, became acquainted with them. They have, physicians that are experts in this field, and their advisory board, and they're just not somebody that's putting forth something that everybody thinks it might work. I mean, there's definite information that is available from some of the most widely respected experts in the field. It's been a very pleasant experience. I have not been disappointed in any way. Been very happy with them. They're a very supportive company.